meeting. And by way of introduction, here with us today is an expert in research methodology, statistics, health statistics, biostatistics, a real-world evidence global consultant, senior international faculty researcher, and expert in higher education. In terms of educational degrees, he has a bachelor's degree in dentistry from Ethnicon Kapodistrian Panepistimian Athenan University, Master of Science degree in community dentistry with an area of concentration in nicotine addiction from Ethnicon Kai Kapodistrian Panepistimian Athenan University, and a Doctor of Philosophy degree in community dentistry concentrating on modern epidemiology and biostatistics from the same university. In his quest for further knowledge, he obtained a short course certificate in qualitative research from University of Oxford and a short course certificate in causal inference in epidemiology, recent methodological development from London School of Hygiene and Tropical Medicine at University of London. He has worked in several teaching and leadership roles and recently as a senior core faculty at College of Health Sciences and Public Policy, Walden University, and Vice Chair of Research Curriculum and Academic Policy University Committee at Walden University. Currently, he works as a senior lecturer in research design and method and senior researcher at the Swiss School of Management, Switzerland. It's such an honor and huge privilege to have an outstanding and noble professor for this year's annual Health Week. Joining us today is Professor Vasielios Margaritis.
Thank you, Victoria. Thank you so much for a very warm introduction.
What's your take on the current state of COVID-19 pandemic in your country of residence? And if you can also give us idea globally, that's also fine.
Yes, thank you, Victoria. So as you may know, I'm in Greece now. This is my country of permanent residence, and I'm traveling a lot for my university and other research projects. But for the summer, I am in Greece. So unfortunately, in Greece, in Europe, and globally, we have an increase in cases, and both in hospitalizations and in severe COVID cases. And this is, of course, because of the interaction of, the travelers. We have a new variant, the Aries variant, which is a little bit more aggressive. And also, as you know, the people now are, because of the heat, especially in Mediterranean and in Northern Hemisphere, they are in enclosed places with air condition, without using masks. So the air is not as clean as it needs to be. So we have this increase, and thankfully, we do not have a high burden in the healthcare system, although we have still high mortality rate among the elder, among high-risk population groups. So we need to be careful about that. The other thing is that we have globally now, we study long COVID, as you all know, the consequences after the infection. So maybe, and we have new research on that, the literature says that even a mild infection can result in severe outcomes in several systems of the body, like the cardiovascular system, the neurological system, also the, to decrease the immunity system. So COVID still is out there, is not something that we need to take this lightly, and we need to be careful with that. And I think you will ask, as I saw from your question, about the vaccination and what is the vaccination status. So after, I think, the third dose, globally, all the people, you know, and the governments didn't push for further vaccination, or they focused only on high-risk population groups, like the elderly, etc. But the problem is that who is really at high risk? We have a high rate of obesity, especially in Europe and in America, as you know. So these people are at high risk. We have also a lot of people with hypertension, right? So also a significant risk factor to have consequences when someone gets COVID. So we calculate that the high-risk population group in Western countries can be about 60%, which is the majority of the population, plus the elderly and so on. So we need to focus more on vaccination, on updating the vaccines with new combination of vaccines, so we can address the new variants. And we need to do again a large campaign globally, like not exactly what we did 2 years ago, but we need to insist with that. But to limit the consequences of COVID, and as I said, of long COVID, which is the most significant thing that we are afraid of, we need also to focus on measures like cleaning the air, using air purifiers, especially in schools, in hospitals, in public buildings where a lot of people are living together. Also in Japan, in other countries, restaurants start using these air purifiers, and the public rating depending on the quality of the air. So this is something that we forget, and it is the only alternative to the mask. So if we are in an enclosed place, like a supermarket, like a plane, and of course, in a hospital, this is a requirement, we need to wear good and effective masks like N95 that now are readily available. I know it's not the easiest thing to do, but we need to try to do that to protect first ourselves and then our family, etc. So this is the global what's happening now with the COVID-19.
All right. Thank you so much, Dr. Vasielios. I think you emphasized on air purification. You also emphasized on another kind of increased global campaign. And you also emphasized on the need for combination of vaccine. Apart from the primary series, the booster vaccine in combination with primary series is also very important. Thank you. And with that, we'll go to the next. With that, we'll go to the next question. Okay. In fact, you have already addressed part of the second question. So we can easily move on to the third question. And the third question is, how can we debunk the myth of vaccines causing autism and alleviate people's fears and lack of trust in vaccines?
I know, and thank you, Victoria, for this question. You know, vaccine hesitancy is one of the major public health threats globally before the pandemic. In many countries, there is this myth all started from one study, the Wakefield study that was retracted, tried to connect one vaccine with autism. This is completely nonsense. There is no evidence about that. There are no studies. It's just conspiracy theories that try, to circulate. And unfortunately, a lot of these people who try to circulate these conspiracy theories, they do this in purpose. They gain money to do that because they take advantage of the not good trained public in public health and vaccines. So this is a huge topic. So in brief, we try as doctors to explain to the public what vaccines do, that are preventive measures, they are not therapeutics, that they try to prevent us from the heavy consequences of a disease. But this does not mean that we cannot catch the disease, that we cannot be infected. And this is a big misunderstanding. They say someone, I did the flu vaccine, but I got the flu. I did the COVID vaccine and I got the COVID. Of course, some vaccines can have some better effectiveness and some other not, but the main target of the vaccine is to prevent the severe consequences of the disease. And we try to explain that, and thankfully, the great majority of the scientific community, all the universities globally, all the medical associations globally suggest vaccination. So it's either for the children, of course, for the pregnant women, and so on. So what I can suggest is we need to try to get information from resources that are reliable. As I said, universities and associations, and not from a person or even a doctor from the internet who has a theory and tries to disseminate that. And we try hard about that. As I said, it's a global public health threat. And I know that in Africa, we have a lot of issues with that, but also in Western countries. We have a huge wave that children did not do their regular vaccinations during the last years. So we need to catch up, and we need to be ahead of diseases that were disappeared, more or less, like measles. And, we need to focus more on promoting, again, vaccination in populations. Issue medication abuse, especially in Western countries. We have overprescription of drugs and medication. Again, it's a very tough issue because especially with now we have a more elderly population, with more complicated diseases and receiving multiple medication for different diseases. Sometimes the doctors and the patients feel more confident to use medication, and this can go out of control. We need to be more strict about that. We need to have more regulation in all countries. There are measures to do that, but it depends on the medication and on the healthcare system. For example, only recently in Greece, we started to get antibiotics only with doctor's prescription. Before, you can go to a pharmacy, say, I want a penicillin and amoxil, some antibiotics, and you can buy that. And this also happens for other medications. So we need to have more regulation for that. Also, we need to have better training of the doctors and the nurses so that they can use medication and suggest, recommend medication more wisely. And of course, always we need to inform the public. We need to have campaigns about that, public health campaigns, informing the public about the consequences of drug abuse and medication abuse. So this is a very complicated issue because each country has different regulations and healthcare systems, but we can cooperate all together and try to find these gold standards about that. So to raise awareness in both doctors, healthcare professionals, and the general public. And you know, mental health issues, it's also a pandemic. It started before the COVID pandemic and it continues because also of all this, the shock that the global community felt with the COVID pandemic. And the big issue with the mental health issues is the stigma. Many people are afraid to discuss about that. They feel that if they try to share their anxiety or their concerns about their lives with professionals, this is something very bad, that someone can tell them that they are crazy or that they cannot handle their personal life. And on the other hand, the healthcare system globally does not support adequately mental health issues as needed. For example, we can someone can get a better treatment for diabetes, but not for depression. And so we need again to work in both sides. The healthcare system must integrate better treatments and preventive measures for mental health issues, as we do for obesity, for hypertension, for all these pathological issues. We need also to focus on how we can prevent suicide ideation, how we can prevent depression. And this must start from early age. We see at schools how a lot of children are struggling with their lessons, with digital addiction, spending a lot of hours in front of a computer, playing, with their mobile phone. And this start to isolate these children and then to feel depressed, connected with cyberbullying, via the internet and all this stuff. We need to develop more effective strategies. We have some initiatives, but not as countries and globally, so we can have preventive measures about mental health issues. And of course, for the adult population, we need to have more person-centered approaches. Mental health can have a great variety of diseases and with different causes and different outcomes, different symptoms. So we need to be more focused on the person, on the personality, how this person feel has this mental health disease. What is exactly? We usually say, I have depression, I have anxiety, I have stress. All these can be very different and have different scales of severity. So we need to the bottom line is that we need to have more patient and person-centered approach, and and also to inform the public that they can speak about their problems. They need to ask for help. This is not something bad. It's like you have diabetes, something pathological. It's health, and we need to treat this equally as physical health. And doctors also and healthcare professionals need to understand that. They cannot say that, okay, you have mental health issues, you cannot get your treatment as needed. We need to focus more on that and try to guide our patients to the right direction. I always say that public health is so important globally to prevent diseases, and primary and secondary prevention, right? Even if the disease appear, this is also very, very important. And the final words that I want to convey, especially for the healthcare professionals, is that we say that they are not disease, there are patients. So we need to focus on the problem of each patient, and each disease can have a different outcomes, symptoms, and demonstration of signs and symptoms in each patient. So we need to focus on that and not what we learn from the university. I know this is 1, 2, 3. We need to more individualize our approach and treatments. I think this is a takeaway that I would like to convey.
Thank you so much for coming to today's discussion. We appreciate you and we look forward to having you for subsequent health discussions.
Thank you. We'll do that. Thank you so much.
Okay. Thank you everyone for
Bye-bye.
joining. Okay, bye. And with that, we come to the end of today's health panel discussion with Professor Margaritis. Have a great day, everyone.
Bye-bye. Thank you.